everybody. Welcome to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing private practices from all over the United States. Every week we come here to gain new perspectives, to get new information, and to meet amazing folks. And today I have a great special guest for you. I want to introduce you to Dr. Igor Chaplik. He is the owner of Aesthetix Dermatology located in Fort Lauderdale, Florida. Welcome, Dr. Chaplik.
Thank you. Thank you for having me. Thanks for the opportunity.
Yeah, we are so excited to chat with you. I know we have a lot to get into, but I would love to start out with just hearing a little bit about your story. What inspired you to open up your own practice, but also what inspired you to get into dermatology?
That's a great question and really a broad way to start the conversation. But basically, dermatology is a great field in the sense that um, as a dermatologist, I get to treat all age groups. We get to treat from infancy to older age,
Hmm.
and we get to see families. We get to see chronic conditions, acute conditions. We also are able to use our internal medicine skills to treat all kinds of systemic illnesses, while at the same time being able to use our hands and do some surgical procedures. So it's a field that gives you a lot of flexibility in what you can and can't do, and also a broad sense of patient care where we can see patients in all different age groups, all different states. And it's really one of the best fields as far as visually, too. And so a lot of times we can see a condition or treat a condition without ordering a lot of lab tests, a lot of hospital stays and things of that nature where things just present itself on the skin. It's very challenging too, very broad. And so for those reasons, I was drawn to it because in a sense, it's very easy to a lot of people, but very, very complex as you get into it.
Yeah, absolutely. And it's something interesting that you said about, it is very visual. And so it must feel so good being able to treat someone, but then actually getting to see the progress. So many times in medicine that, healing is sometimes within. And it's so great to see that progress on the outside and then also how that person does feel on the inside about themselves later on.
Yeah, and that's a good point you bring up because results-based care is very important. And so being able to show somebody the results before and after pictures or just them seeing the progress is really rewarding and impressive. A lot of times you can't really, like you said, you can't really see your lab work change. Say you're anemic and then, you are doing everything you can to supplement and doing everything right. And then, but you don't see anything until you go and get lab work. And the lab work is just a snapshot in life. It could
Right.
be off, but then in the day it could be normal. And so, like you said, it's a great point. Sometimes when you could see the results, they're a little bit more rewarding and also encouraging. So, in that sense, it's also a very rewarding field.
Absolutely. And maybe you can touch into a little bit of the different services that you provide, maybe down to what are some of the most common things that you see coming through your office, down to, maybe some things that you don't see that often, but it's something that you do treat and would love people to know about.
Really good question. So my practice and me in particular is very wide range. I provide services from, like I told you, infancies, babies born to, people that are, later in life care. And for that reason, I also provide general dermatology. I also do a lot of surgery, skin cancer surgery, skin cancer detection. I'm a Mohs surgeon, and we do also not just skin cancer removals, but then we also do facial reconstruction after those removals. And so, um, and then there's also the aesthetic realm where we perform a lot of advanced aesthetic procedures and are able to provide patients with the results that sometimes are not necessarily attainable in other places that don't have the the doctor that's skilled in both surgery and general dermatology. And so that is what I think kind of distinguishes my practice from some other practices where we're able to provide the full spectrum of dermatological care from general dermatology like acne, eczema, psoriasis, to more surgical dermatology where we not just remove the skin cancer but also reconstruct the defects and also with a eye for aesthetics. And so when we treat our patients in this practice, we try to make things imperceptible. So basically kind of an eraser. You come in with a problem, you come out and you can't see it again. And that's kind of our motto, so to say, what we try to accomplish for our patients in this practice.
It's so nice to have that wide range and spectrum of things because I think we've all sat somewhere before where you wish you can get everything done all in one. You want someone to be able to have that perception of, okay, I'm not only a dermatologist, but I'm a Mohs surgeon, but I'm also really skilled in aesthetics. And so when you come in, for that surgery or for something that's really visible on your face, and I can not only remove it, but hide it really well. That's really exciting. And, I think I think we've all heard stories of like, oh, I gotten this removed, but you know, they removed it. Great, but it doesn't look as nice as it could, right? And so, those are some things I think people are thinking about. But something that you had also mentioned is that you see people, which I think is really unique about what you do. You see people from a really young age. So I'd love to learn a little bit about, what are some of the drivers for folks coming in with, very young children, babies? Like what are some of the things that you're commonly seeing with that?
And the most common thing with babies is just, eczema,
Okay.
seborrhea, cradle cap. Those are just the easy things. And then as the kids get older, there's warts, molluscum, like things that are contagious. And
Right.
then you get into more like older kids, acne. Sometimes they'll have like accidents that need to be sewn up and things of that nature. And so it's interesting having worked here for 20 years now, where I used to see kids with acne or kids with warts, they're coming in with their kids now. And so it's really interesting to see. And it kind of gives you a sense of being almost like a family practitioner because you're treating people from such an early age. They still stay in town and then they come in with their problems and then they bring their kids. And it's like a full circle of being able to help. But those are the most common things. We will get rare, occasional things that aren't so common with children. Hopefully, we don't see much of that. Most of the things are just like what I mentioned, the typical stuff that kids get, eczema, psoriasis, warts. But also, it's important to, in my mind, be proactive and knowledgeable about those conditions and be able to help kids in ways we couldn't help them in the past. Maybe 20, 15 years ago, we just give them a cream. We would do topical treatment, and kids weren't always that much improved with this stuff. And so a lot of kids grew up with eczema that was bad. It can affect sleep, it can affect development. And so it's important to stay on top of newer developments, newer techniques as we become, seasoned providers and not just stick to our old ways of practicing. And so that's really important to be on top of the newer medications and newer advances in science so that we can help kids in ways that we couldn't before. And so I pride myself in being able to do that as well. So we don't just kind of practice the way we used to. We go to meetings, we go to CMEs, we lecture, and so that gives us the opportunity to help in a way that's more modern and also appropriate for what's out there, standard of care.
Absolutely. I think when it comes down to the standard of care and hearing how you have seen generations of people and families, which is so sweet to hear. But it's important for growth, development, how you feel on the inside, especially as a child in those formative years, and you have really bad acne or eczema, and then you maybe become a shy person or less confident person, and
Uh,
it's to have someone like you that is interested in really getting down to the root cause, figuring out different ways to treat someone. It seems like your approach across the board is really holistic and looking at the whole person and being proactive and taking those steps. But I'd love to hear a little bit more about, what makes you guys different and what makes, your approach different as a provider.
but what you just mentioned actually is
Mhm.
really important. And so when you see, for instance, a kid with acne, and you see early on that that child is scarring already, and some providers, doctors in the past or even now are not very proactive or aggressive with that approach. We were completely different. My initial consultation will instantly involve serious medication. Not that I want to harm the kid or do
Mhm.
something that is going to, change their
Sure.
life, but I want to prevent a future of scarring that a lot of people aren't as serious about. And that takes me full circle into what I do most now, and my aesthetic kind of inclination is acne scarring. That's kind of what my practice is becoming known for. And so we do a lot of um, more advanced techniques for acne scarring, where we do subcision, we do full ablative resurfacing, and the goal is not to have to do that. The goal is to be able to catch an early onset acne where we could see that the child's going to scar and do something about it so that it doesn't become one of these visits where we have to do, fully ablative laser resurfacing where the patient's home for 2 weeks, or, where we have to do subcision where we're, basically releasing the tethered acne scars. And so I think that having that perspective of having to reverse someone's damage and
Yeah.
then having to be able to prevent it is kind of very important and holistic in a sense where you can see what it can do, explain it to the patient and the parent, and hopefully get through to them and have them understand that, yes, there are ways to prevent it. They're not a cakewalk. They're not
Yeah.
just here's a cream, here's a cleanser, go home. They're going to involve lab work, they're going to involve medications, they're going to involve visits, but it could really save you a lot of, like you said, social anxiety. It could save you a lot of confidence issues. Even when it comes time to dating or time to graduate to college, those things are kind of often overlooked, but the person with it suffers, and they suffer a lot of times in silence. And
Yeah.
so it's important to have that conversation early on and at least educate the person, at least, mention it, and then see if we can get through to them and seeing if we can stop the process before it becomes a big problem. But then
Right.
at the end of the day, even patients who are a little bit older that never had the option or just for whatever reason didn't have it available to them, we can help it. We can help reverse it. And the newer techniques that we're providing were just not available when I started practicing 20 years ago. And that's another concept that I think is important when you choose a doctor or provider, somebody who's on top of the latest advances, is always learning, going to CMEs, going to trainings, so that they can give you, what's out there and not just say, well, that you're not a candidate because I don't know how to do it, or you are a candidate, this guy knows how to do it, or I'll do it for you. So
Right.
there's kind of different ways to approach a patient.
Yeah, and speaking of, keeping up with, what is new, what is happening, but also what's tried and true and good, I'd love to hear, and especially since aesthetics is a huge part of your business, I think also is often played with a lot of misconceptions
Oh, yeah.
in terms of, people come in and they're like, well, I saw this on Instagram or TikTok, or I chat GPT'd this, or I asked Claude about that, and this is what it told me. And you're like, oh, I wish you didn't say that, or I wish you didn't read that because it gives maybe unrealistic expectations, or it's simply not true. So I would love to hear maybe from the aesthetic standpoint or general dermatology as well. Like what are some of the biggest misconceptions that you feel like you are constantly debunking in the office and you just like to nail it down right now and say, nope, this is so not true. Um, you can ask me this 5 different ways, but it'll never be true, or whatever it might be. But I'd love to hear from the pro's perspective about, a little bit of, you know, truth into some of these things.
Rachel, that's a baited question because I could just go on and on about,
Could be a
you know,
whole other segment.
yeah, I mean, and you ask any doctor, they'll, yeah, there's Dr. Google first. That was the first kind of you know thing we'd get in the office, and then with
Sure.
ChatGPT, and then Claude, and then Instagram, social media, influencers, skinfluencers. There's all kinds of stuff out there, and it's
Yeah.
really like a lot of information, and it's bombarding people with things that may or may not be true. But my job isn't to criticize it or say this is good or this is bad. And I think that it's like anything else with a grain of salt. You get your information, and then it's your job to process the information. It's not really my job to police it, and it's not anyone's. There's a lot of information out there that's correct. There's a lot of misinformation out there that's correct. And that's really the job of the physician, is to, welcome the patient, understand that the patient has some knowledge and some information, but then also provide them with the right knowledge and information. And I'm not always right,
Mhm.
but I have a lot of experience. I have a degree, I have a residency, I'm board certified. And so I do think that from that perspective, we're a little bit more diagnostically accurate than search engines, but not always. But we're also able to provide techniques and things that those things don't. They just kind of are suggestions in a sense. I
Yeah.
do think that one of the trends that I do not necessarily agree with and wish wasn't so prevalent is all these different creams that have to go on a kid's face. There was a trend when kids as young as 8 were going to Sephora or going to these stores and buying 10 different creams, and then they're like broadcasting on how their regimen is. I put this one on first, then I put this one on, then I put that one on. And all they're really doing is just creating a problem. There's too much creams, there's too much irritation. 8-year-olds don't need all these creams. We were perfectly fine 300 years ago before we had a single cream. Really all we need is a sunblock. And then as we get older, we may need like a little retin-A and things of that nature for anti-aging, for uneven tone and texture, wrinkles, acne. But and there's some really good creams that are in the middle between being active and
Yep.
doing nothing that are helpful. But I do think that too much of anything is not always good. And I think, especially as it relates to young kids, A, there's a cost to this, B, there's time consumption, C, you can be creating problems. And it's just not necessarily what I think as a society we should be kind of encouraging and or condoning. There has to be kind of some sort of policing of that where we say, as whether it's from our society or some sort of an article, or actually instead of skinfluencers being so popular, maybe get some board certified dermatologists to answer some questions on live TV. That used to be a thing where, you get a person on TV and then, an interviewer and say, hey, what do you think about this?
Yep.
And then I think that's kind of one of the things that I see that I don't necessarily appreciate. But
Yeah.
I think, with anything else in life, with technology and advances, all of that's going to happen. And it's just something we have to kind of roll with and understand and process. We can't be blind to social media. We can't be blind to what people are saying. We have to understand it, be able to either correct it or actually agree with it. Some of the skincare coming out of Korea is actually amazing,
Yeah.
but some of it is a little much.
Yeah, I couldn't I live less than a mile away from a Sephora, and every time I go in, I see these young girls running around, and then I see them stop at, some of skincare lines which I know have like retinol in them and and I'm like she can't be any older than 8 years old,
Yeah, and
you
there's just
know?
no need for that. There's just, unless you have a condition that retinol will help with, you don't have wrinkles at 8.
No, no, no.
You don't
And
have like sun damage that you need to correct. This whole glass skin thing is just, it's not realistic. It's almost like what we were doing, and unfortunately, in objectifying women with the whole modeling industry maybe 10, 15, 20 years ago, where everyone needed to be a certain way. And now it's like your skin needs to be a certain way, but it's just not realistic. We're human,
yeah.
and we're meant to look human. We're not meant to look like aliens or like glass or like people who have artificial big cheeks and all kinds of stuff with, you know what I mean, I think.
I totally get it. And out of all the provider spotlights I've done, you've really been the only person to address this and like young children and to share this. And I think it's a really important note to emphasize a little bit. And for all of us too, like there's like a healthy middle. I think
Yes,
like what we're trying to get at is that there's a healthy middle, and we don't need to go to the extreme at 8 years old, but then also as we get into midlife and we are seeing some wrinkles or some imperfections or, that we don't need to go necessarily overboard either.
what you said actually rings true. And so that is really good that before, like what, 40, 50 years ago, no one paid attention to their skin. It was like
Hmm.
secondary. We didn't use sunblock. We cooked it. We didn't really care.
Yeah,
But now come full, everyone cares so much, but it's a good opportunity for empowerment and for knowledge. So yes, this is great. Now we can actually change things. So okay, you're starting really early. That's amazing. You're 8. Get the sunblock. Get a good sunblock that you like, that goes on nicely. Learn to reapply it. That's a trick that a lot of times is often overlooked or neglected. You know, Putting on a sunblock once isn't enough. You're out there 2 hours or you're swimming, you have to reapply it. If you're swimming, it comes off. And nothing is really waterproof. It says waterproof, but
right.
it's not. So that's a good opportunity to say, you know what, you're right. Your skin is important. Here's a product, but you have to use it more than once. So
Yeah.
instead of all of these 8 products that you want to use, here's one. You can use that one 8 times. How's that?
Right.
And so
Yeah.
it's, I think it's a good opportunity to get them on the right track because now everyone's actually involved, engaged, and concerned. Well, here's the right thing for you then.
Yeah, absolutely. I couldn't agree more. I think, your advice is fantastic in terms of this because I think, again, we're often caught in doing too much or doing too little, and we kind of need to find the Goldilocks approach to, our skincare. And on that end, I'd really love to round out today because you've given us so much to think about, as far as misconceptions to your background. And everything in between. But I'd love if you could maybe spend a little time in giving us some pro tips because you already given us one, finding our Goldilocks approach, not doing too little or too much. But are there other things that you can educate all of us on? And we're also great reminders for other providers out there. General practitioners are referring to you guys. Things for them to keep in mind too about, hey, like I should definitely be telling my patients this, or send them to Dr. Chaplik. Like this is important. But anything that you can share with us that will, move our health trajectory forward, in your eyes, and things that we can do today that will help.
So yeah, well, that's also a very broad, complex question. It can be answered in separate parts. I
Yeah.
think that we can do it as a proactive, preventative approach.
Yep.
And that's very easy. That's basically keeping it simple. Use a cleanser to wash your face.
Mm-hmm.
Don't use soaps, harsh abrasives. Avoid perfumes and fragrance products.
Mm-hmm.
Um, and then sunblock. That's it. Basically, find a block that you like. There's a lot of misconceptions out there that sunblocks cause cancer or that they, kill the environment. Find a sunblock that's made of zinc or titanium. Those are inert. Titanium is used for rods and pins. It's not going to harm you. It's an inert chemical. Zinc is a mineral. We eat zinc. We need zinc. We put it on babies. It's in baby paste. It's very safe. So if you have a negative concept or are fearful of
Mm-hmm.
sunblocks or the industry or being lied to or causing cancer or whatever it is that prohibits you from using it, find one that has those 2 things in it, and there's no reason not to use it. You can put on a baby, it's been studied. Zinc, you need to eat. We measure zinc levels. So these are the things that are not going to harm you. So there's no reason not to use a sunblock other than you want to get vitamin D. And then, you know, also what I want to say as a pro tip is that go out there and have fun. Don't be stuck at home because you're scared or you're fearful of cancer or you are fearful of getting old. You need to go out and have fun and enjoy life, and you need to be in the sun. You heard it here. You heard it from a dermatologist. Go out and enjoy yourself. Don't stay home because you think you're gonna have a problem. But protect yourself. It's like anything else in life. Everything with moderation, and you know that the sun is harmful. If you don't think it causes cancer, it'll cause premature aging, it'll cause freckling of the skin, it'll make you look older. And so there's a lot of different reasons why sunblocks are very important and proactive, preventative, and part of the process of health initially, where you can prevent a problem. And then breaking it down into a pro tip in the middle as we get a bit older, you got to do skin checks. You got to make sure that you're safe. You got to, develop a rapport with the dermatologist, particularly in Florida or in sunny states where you've had some sun exposure, where you can actually prevent a problem. In our 40s to our 60s is kind of when things are, you know,
Mm-hmm.
caught early on, very preventable and treatable. But if neglected, that's when you have a family or you're young. You don't want to have a problem in that age group. And so in the middle of life, it's important to establish care and start going, getting skin checks. And then as we age, it becomes a bit more complex of a process. Anti-aging is being bombarded to us. And then, there's a lot of different peptides, exosomes, buzzwords, PRP, so many things on the market right now that it's very challenging to understand what it is that you need. So I
Mm-hmm.
think, and to save time and brevity, I'm not going to discuss pro tips on aging, but I will say that we all age differently and we start aging extrinsically, meaning we start to age because of environmental factors, whether we smoke, whether we're in the sun, our
Mm-hmm.
environment, how healthy we are, how we eat. And then as we get older, there's intrinsic aging, meaning we lose volume in our faces, we lose our fat, we lose our muscle, we lose our bone. And that's really just based on genetics. That's not really necessarily
Yeah.
alterable or preventable. In women, it is if you start to supplement early on, you need your calcium, vitamin D, make sure your bones are healthy. Women age differently than men. And so that's kind of in a nutshell some pro tips from early on, middle life, and as we get older, finding somebody that understands the aging process and knows how to reverse it naturally, not just make you look different or make you look like an alien, but make you look like you looked maybe 10, 15 years ago and know how to do it and explain it to you because it's important to understand how people age in order to help prevent it or reverse it.
I love that. I think that is such a great comprehensive answer. But also, yes, go see someone like yourself that understands the aging process and have fun. And I love live your best life, Dr. Chaplik says. So I appreciate that because you're right. We all get a little caught up. And there's ways to do things appropriately with someone that truly, like yourself, understands. How you're aging, when things are happening, what to look out for to be proactive, but not overdoing it at the same time and being safe. So I couldn't agree more. I appreciate all of what you shared with us today. And before we leave off, I'd love if you could share where folks can find you, where they can reach out and grab more resource.
Oh, thank you. Yeah, so we're in Fort Lauderdale, Florida. The name of the practice is Aesthetics Dermatology with an X. My last name is Dr. Chaplik, Chap as in Peter, Lik. Office phone is 954-772-0416. And we're very much a mom and pop operation. We're not a huge practice. I know everyone by their names. I know where they go on their trips. I know their kids. And so, in the days of medicine becoming more and more concierge and more kind of selective, we're a concierge practice without any kind of concierge fees. We try to keep it to just a good number of patients. We're not a mill, and we treat people like family here. And so, I think that's important in today's day and age where there's still some people out there, some providers, doctors, physicians who have an old school mentality with kind of a new school approach where we know what's out there. We're advanced in that sense, but we treat our patients like a good old-fashioned doctor should.
I love it. Well, thank you so much, Dr. Chaplik. It has been such a pleasure getting to know you. Thank you for sharing your knowledge and your time with us, and we hope to have you on again very soon.
Thanks. Thanks for the opportunity.